Video I'll be talking about Buspar, otherwise known as Buspirone. We need to know the mechanism of action. Basically, it works by balancing the level of serotonin and dopamine in the brain. Specifically, it's going to be acting as a partial agonist for the 5-HT receptors. It is also a non-habit forming medication, unlike the benzodiazepines like Xanax or Valium. Buspirone is not a controlled substance and it does not carry a risk of physical dependence or withdrawal. We need to also know the onset of action. It is not a rescue medication for immediate relief of anxiety, so typically it takes about 2 to 4 weeks of consistent use for it to achieve its full therapeutic effect. You don't have to use it for acute anxiety, you don't have to use it for panic attack. It can take several weeks for its effectiveness to be seen in the patient that is taking it. What are the indications for the use of the Buspar? It's an anxiolytic medication primarily that is used to treat generalized anxiety disorder, which is our GAD. It's also used for short-term treatment for the relief of anxiety symptoms. It is the FDA-approved medication for generalized anxiety disorder. It can also be used as an off-label medication to treat treatment-resistant depression. We can also use it as an adjunct medication for the treatment of anxiety and depression. So we also need to know the common dosage. Most of the time, it's often begin with 15 milligram daily. Typically, we can also give 7.5 milligram twice daily. The maximum dose that can be used is 60 milligram per day. So then also the administration, it must be taken consistently either with food or with or without food, basically, as food can significantly increase its absorption. What are the common side effects? So most side effect is always mild, and at a particular point in time is going to diminish over time. So patients most of the time present with dizziness, lightheadedness, nausea and headache, some drowsiness or nervousness. But there is a very rare or serious symptoms, but we don't really see that, but it's very serious. Patient can present with unusual body movement, easy bruising, and a signs of serotonin syndrome. That is if it is taken or is used with any other serotonergic medication. What are the important precautions? So if patient has to take Buspar and they are on large amount of grapefruit, this should be avoided because the grapefruit is going to increase the blood level of Buspar, and that can make the patient to experience more of the toxic effect. Monoamino oxidase inhibitor, you don't want to take it with Buspar within 14 days of using monoamino oxidase inhibitors. So what we're trying to say is that you must have stopped monoamino oxidase inhibitor like about 2 weeks earlier before you start to place the patient on Buspar medication. And why? Because if this is taken together, it can dangerously increase the blood pressure of the patient. Patient can end up having a high blood pressure. Buspar basically is metabolized by CYP3A4 enzymes. So that means that you are going to take a lot of caution when you are giving Buspar with all the inducers of CYP450 and the inhibitors of CYP450. It's likely going to increase or decrease the breakdown of Buspar. For example, basically in one of our videos, I've already explained the relationship between the inducers and the inhibitors in correlation to the CYP450. So if a patient is taking Buspar and that same patient is placed on phenytoin, so phenytoin is known to be a potent inducer. If it is taken together, it's going to decrease the amount of buspirone in the system. So if you are combining these two medications together, the PMHNP has to know that the patient's dosage has to be increased because phenytoin is going to lower the blood level of Buspar. So in that situation, we are going to kind of increase the dosage of Buspar if it is taken together. I'll repeat that again. Phenytoin is an inducer of CYP450. So basically, if it is taken together with Buspar, it's going to decrease the amount of Buspar to reduce the amount in the system. So if a patient has to take Buspar and phenytoin together, it is required that the PMHNP might need to increase the dosage of Buspar so that the therapeutic effect can be felt. We go also that in contrast, we can also bring that in the aspect of prescribing inhibitors. A potent inhibitor is Prozac, which is our fluoxetine. So if peradventure a patient is taking Buspar and that same patient is placed on fluoxetine, so fluoxetine is what is a potent inhibitor basically. It's going to increase the blood level of Buspar. So when you give the two together, the blood level of Buspar is going to be on the high side due to the fact that the patient is taking Prozac concurrently. So if the PMHNP is going to make a prescription, she might need to decrease the dosage of Buspirone because the patient is actually taking an inhibitor that will increase the blood level of that Buspirone. So make sure you understand the differences between inducers and inhibitors of any of the enzymes that metabolize medication, because it's going to be very important for safe and adequate prescription. So note that this is just an highlight. For more detailed content review, for you to pass the PMHNP exam, the ANCC board exam, kindly visit our website for registration at www.advancedmpcertificationreviews.com, or you call my number, Dr. Kemi Akinlawo, at 281-372-9148. You can also send me direct WhatsApp messages. Thank you for your rapt attention.